Do you have health care? Do you need it? Well, right now, yes, right now, you got the chance to enroll in coverage. See, President Joe Biden required the government health insurance markets to reopen enrollment periods because of coronavirus. And now you have until May 15th to enroll in a health care plan. We know that this is confusing. You got questions about it. So we have three wonderful experts with us today to help navigate the process. Catherine Sevier of the AARP of North Carolina, Morgan Campbell is with the Alliance Insurance Services, and Laura Packard is with Get America Covered. They are all here to answer your questions. If you got one, you can text them to us right now at 336-379-5775. Remember, this is a text-only number. One of the questions that I have heard so far is, can I sign up if I think it might be cheaper than my current plan?
Yes. Yes, absolutely. Right now we are in open enrollment 2.0. We can make changes to our plans. We can buy up, we can buy down. We can even switch carriers right now.
Now, does that include if you have private insurance through your work at the moment?
Insurance through your work is not going to apply to what this open enrollment is. You're going to have your own open enrollment at your work.
So what is this open enrollment? Let's lay it out for people.
So this open enrollment is basically for the folks that didn't get in the first time when we ran open enrollment from November 1st through December 15th. And they just missed that time frame to jump in and purchase health insurance. They now have that opportunity to do that.
We have someone wondering, can I sign up for this if my spouse has health insurance through their work?
Those situations get a little bit tricky. Some employer plans do not allow any dependents to come onto their plan. So that would be, we would need to get the details of the employer plan to see if they allow dependents to come on or not. So that's kind of a specific situation for each person and employer.
And so what does someone do if they have a situation like that? Who can they reach out to for help figuring all this out?
They should first start off with their HR department or anyone who is handling their benefits for that company. And then they're more than welcome to call me and I'll maybe step them through it all every step of the way.
Well, I'm sure they will appreciate that offer. Thank you so much. Someone's wondering, how are the price points set for all of this? Are they cheap?
So that really depends on your income level and what type of plan you're looking to purchase. You always want to pick a plan that's going to fit your needs and what's best going to serve you. We all work off of an income table. So if you fall anywhere between 100 to 400% of the federal poverty level, you qualify for a tax credit or a subsidy to help offset the premium of the plan itself.
And just to be clear, I think I heard you say this earlier, there is no penalty here for changing plans.
Correct. There is no penalty for changing plans. The only thing that I would caution is if you had started meeting some of your deductible or your out-of-pocket max, if you do change plans, you're going to have that money that you've already paid in and it's going to go back to zero when you actually change that plan out.
Laura, I think you were saying something about the cost earlier.
Yes, right now Congress is working on a bill, the American Rescue Plan, and if that gets signed into law, which it might in the next week or so, that's going to change a lot of these numbers. First, it will make it so that no matter how much money you make, you won't have to pay more than 8.5% of your income for your Affordable Care Act policy. So it lifts the cap. In the past, maybe you made a little bit too much money to get help to pay for your insurance, but this will cover everybody, as well as greater subsidies for people that make a little less money, and incentives for North Carolina to expand Medicaid to cover people that are below the poverty line right now. So there could be up to 500,000 North Carolinians could get insured if North Carolina expands Medicaid.
I think that's really something that some people are looking forward to, but it's being debated right now. If that passes, do you have to go sign up again, or does that automatically just apply to you?
That is a good question, and I don't think people have figured out the mechanics just yet, whether the tax credits will apply instantly. So what you might want to do is hold off for the next couple weeks while all that gets sorted out, because I wouldn't want you to miss out on any tax credits that you could get.
Just make sure to set an alert on your phone so you don't miss the sign up before the end of May 15th, correct?
Absolutely. And also make sure to contact your legislators. If you want them to make healthcare more affordable and available, make sure that they know that.
So we're still getting lots of plans about open enrollment right now. Someone wants to know, can a 19-year-old sign up on their own if they still live at home?
They can. You're going to get into a situation where you probably should consult with a CPA. And if you're going to file that 19-year-old on your tax return, typically the way we work is we look at the household income. So if your 19-year-old is going off to college and they've got an address in Chapel Hill, so to say, that might be a different situation. So I would advise to always check with the CPA first and make sure you have a game plan as to where you're going to actually file that dependent.
We're getting some really good questions in right now. Don't forget you can text yours to 336-379-5775. One that I'm pretty curious about, someone says, my husband's planning on retiring soon, but after open enrollment. Should I go ahead and enroll now?
If the husband is going to be retiring and he's going to be losing the health insurance benefit piece, that actually opens up a special election period. So at that point, he has 60 days from the date that he loses coverage that he can get in without a problem.
This is all very complicated. I'm so glad you three are here to help us through it. We're going to have much more when we get back, including talking about underlying conditions and what that may or may not mean for you signing up. We'll be right back. Hey there, welcome back. We are still here with our three amazing experts with everything you need to know about healthcare enrollment and open sign up. One thing that we were talking about during the break is that right now the U.S. Senate is debating a bill that might have some impacts on people who were unemployed and their insurance. Laura, you want to tell people about that?
Sure. Well, I mentioned before that the bill will help subsidize Affordable Care Act policies for people that make a little bit too much to get help right now. But also this bill will include money so that if you lost your health insurance by losing your employer by being laid off, it would cover 100% of your healthcare premiums through COBRA. So you can keep the insurance you had through your former employer. And if this goes through the way it's written right now, it would kick in at the beginning of next month and it would carry through the end of September. So you basically would have your insurance covered for a few months at least.
So speaking of prices, people are wondering, is there a cap on the price insurers can charge you?
At the moment, the Affordable Care Act only limits costs if you make under 400% of the federal poverty line. So it's different for every family depending on how many people are in your family and so on. But this bill would lift that cap. So no matter how much money you made, it would be limited to 8.5% of your income.
Okay, all of this can just be so overwhelming. So let's start back at the beginning. Someone had a question here. What is the difference between Medicaid and Medicare?
So there's a significant difference between the two of them. Medicare is the benefit that you accrue or are eligible for when you turn 65. It is intended so that as you move into retirement, you have coverage that will continue through the rest of your life, and you cannot be denied for it when you apply for it. The important thing about Medicare, though, is you have to apply when you turn 65, and you have a window that's 3 months before and 3 months after. And during that time, you have to make some decisions about what benefits you're going to have and how those are going to move forward. And we always remind people that because of the way Medicare is structured, there's Part A, which is hospital insurance. Part B is physicians and outpatient care. And if you do not choose Part B, and you go back later, you will incur a penalty that will be there for the rest of your life, and it is a steep penalty. So you really want to understand what you're signing up for in that 65 window. In contrast to that, Medicaid is a completely different benefit that is provided predominantly for lower income and people with disabilities who need assistance for their health care insurance.
Well, I'm so thankful too that you went through all the different parts because people were having questions about those. They want to know right now under open enrollment, can they sign up for another part that they didn't sign up for before?
I'm sorry, I didn't hear the question.
Can they sign up for a different part of Medicare that they didn't sign up for before?
You are not able to just move in and out of Medicaid as you want. That 65 window is a pretty strict one unless you have a disability and you're moving into the 65 plus range, or there is some kind of a qualifying event, but you really need to focus on that 65. And then once a year, Medicare opens up and you can change your policy parameters at times. Some people have moved from Medicare, traditional Medicare, to Medicare Part C, which is Medicare Advantage, which is much more of a network of providers. And then in addition to that, people are always looking at how to supplement the cost beyond what Medicare pays for. So many people will look for a Medicare supplement, and that usually opens up in the fall, in the regular times that we all buy insurance, that October, November period.
So just to be clear, you were talking about Medicare. It opens up once a year. Are we in the Medicare open enrollment right now, or just for the other plans?
We are not.
So what can people sign up for right now?
This special enrollment period is for the Affordable Care Act only. So you can sign up for Affordable Care Act plans through May 15th. But you can sign up for Medicaid anytime you're eligible. That's open year round. And Medicare, you sign up within a few months of when you turn 65, or if you have a qualifying event, as Dr. Catherine said.
Someone asked, is there a way to get dental insurance through the government?
There is some dental insurance provided through Medicare when you have a Medicare Advantage program, a Part C program, but that varies from one program to the next. So as you're looking at the program that you're signing up for, you need to look specifically to answer that question.
We have someone saying, my wife will be retiring soon, but I already have health insurance. Would her premium be based on her retirement salary, or would my salary be factored in there also?
For Medicare or an under 65 individual policy?
It doesn't say. Let's try to answer both if we can.
So if you're looking at an under 65 policy and you're trying to get a tax credit, then we're gonna use the household income in that scenario.
And what about for Medicare?
For Medicare, she will have to sign up when she turns 65. It is not available to her just because her husband's made that retirement or that age.
Well, a whole lot to unpack here. Again, our experts are going to stick around for a little bit while longer. Send us your text messages, 336-379-5775. I'm reading some really good questions so far. Keep it up, guys. There's so many questions about insurance coverage, and we've got you covered today with three amazing experts who know all about open enrollment here. During the break, a bunch of people were texting in about that 65 and up penalty if you don't sign up when you're 65. So can we talk a little bit more about that? Starting with, if you have your employer's insurance at 65, do you still sign up for Medicare?
Yes. You still sign up, and if you are given the option during that time to waive the policy, waive the Part B, and take it later. But if you don't actually sign up for the waiver, If you just ignore it or turn it down, it is yours to carry with you for the remainder of your time that you're on Medicare. So what we urge people to do is talk with their HR departments if they're employed, compare Medicare, going on to Medicare with what is the best relationship to their current insurance. But in all cases, if that 65 window, do the paperwork so that you're not caught with a penalty when you do finally retire and lose your health care insurance with your employer.
And how long when you're 65 do you have to do this? Do you have to do it before you turn 65 or before you turn 66?
There's a 7-month window, 3 months before your birthday month, and 3 months after. And that window is very fixed. And the paperwork is really pretty direct, but you do need to be thinking ahead of time about making that deadline, put it on your calendar, and then do that investigating if you're going to stay employed during that time to understand what the implications are of going one way or the other.
And you're talking about a 10% penalty here. Why is that? Why do they put that in place?
You know, we get asked that every time we do this program. And the only answer I can say is because it's been there forever. And it actually accrues. And so if you can imagine being 85 and still paying your 10% penalty with the accrual, it's considerable because Part B right now is $148. So think about the 10% accruing on a year-by-year basis.
Sounds frustrating for a lot of folks, but I'm glad you're here to make sure they don't fall into that. Someone else said, I started getting Social Security at 62 and was told I'd automatically be enrolled in Medicare at 65. Is that correct? I see a lot of heads shaking no.
No, you still need to do your paperwork.
You should never trust that you're automatically enrolled in anything when it comes to insurance, correct?
That's a very good piece of advice.
Why is it so important to double check all your paperwork here and make sure that you're signed up correctly?
Morgan, I think you should answer that one.
For Medicare?
For any insurance at all, because I know a lot of us just want to do it and move on quickly, but we really need to take our time, correct?
Right. So if you don't take your time and you don't calculate your income correctly, when you go and you take too much of a tax credit, when you go to file your taxes where you might be accustomed to getting a refund, you might actually have a bill that you have to pay to the IRS. And it might have been due to the fact that you got a raise from your employer and you did not report that to healthcare.gov and you did not update that income and it changed your modified adjusted gross income.
Yikes, no one wants a surprise bill, and you also don't want to miss out on your chance for open enrollment. One more time, what's the best pitch on why you should do it now?
Well, open enrollment is running through May 15th. So if it's after May 15th and you don't have a qualifying event, you will be without health insurance for the rest of the year. So you should go to healthcare.gov now. You might want to do a little shopping and then come back to it in a week or so because, as we mentioned before, there's legislation happening in Washington right now that could change what you pay. So take a look now, shop around, and then maybe go back and finalize it in a couple weeks.
Thank you so much.